Good afternoon. My name is Henry Tama. I am a DNP student with UMass Global. I want to thank Dr. Carl and also the rest of my classmates in this cohort with the opportunity to present my clinical scholarly project. Um, my presentation of my clinical scholarly project to the stakeholders will involve how utilizing mobile application reminders for physical activities and modification adherence in African Americans community with high blood pressure. The objective here will be to identify the roles of each stakeholders, keeping them informed of the progress of how to facilitate the project. I will also include the theoretical foundation and conceptual framework concepts in alignment with my clinical scholarly project. Lastly, I will identify the delivery of the intervention. The next part of it is identifying the historical perspective and significance. We all know the elevated risk of blood pressure or hypertension in African American community is well known. There have been many research that have identified many variables that appear to play a role in hypertension. The risk of hypertension in African American community, therefore, it could be multifactorial. So there are many reasons that could have caused this, such as genetic predisposition, lack of physical activities, obesity, and social and psychological variables, all can play a role in why they have high blood pressure. The prevalence of high blood pressure among Black especially in the United States, is very high as compared to the rest of the world. Black people in the United States have disproportionately high blood pressure, starting as early in their childhood. So the historical and systemic factors have played a role in why they have this high blood pressure, because of things like lack of access to healthcare, lack of access to healthy food, and other social determinants. Also, discrimination has played a major role in how Blacks in America have managed their blood pressure. Certain medications also doesn't or is not effective in the Black community, and in some instances, the Black community needs at least 2 or 3 blood pressure medications for their blood pressure to be well controlled. Again, as we all know, hypertension is defined as a chronic, persistent elevated blood pressure with the value greater than 130/80. So it's very difficult at times to achieve these numbers. So if left untreated, high blood pressure could lead to cardiovascular complications, other cardiac diseases, stroke, and even kidney disease. So it's very important to address blood pressure in early stage. The stakeholders in my educational intervention will be involved. After I've identified all my objective of my project, the goal will be to provide education to the stakeholders. This will be the patients on how to proper implementation of utilizing mobile health application in the primary care settings in controlling high blood pressure. The goal will be focused on adherence through text messaging, reminders, and lifestyle changes through physical activities. The patient-centered model is very important because this involves a coordinated effort between the patient and the caregiver in terms of all being on the same page in addressing the objective. The most important person in this stakeholder is the patient, because proper utilization of the mobile health application can result in controlling hypertension and getting the desirable outcome. Emphasis will be on the importance of adhering on taking medication as prescribed, self-monitoring of blood pressure, and lifestyle modification with diet and exercise regimen. It is very also important that to make sure this patient have proper or adequate training, also proper functioning of their device. They will do a written demonstration on their first visit in the office on how to interpret or read the text messages that they're getting on their phone. Also, the next important stakeholder is the provider. The provider will also need to have a very good understanding, a good grasp of how to implement this project. Will also be responsible to hold monthly or in service to keep all the other stakeholders abreast on the progress. The front desk staff is another stakeholder who will be very important in answering calls, relaying all the important messages from family members and the patients and other stakeholders in a timely manner. The medical assistant is another stakeholder. This medical assistant will be responsible to obtaining the patient's vital signs, including the blood pressure, and they will need to understand proper measurement of blood pressure techniques. Also, they'll be measuring the patient's weight and also, if possible, obtaining blood draws. Another stakeholder will be the pharmacy that will relay to us or the clinic or give us alert if there is if there is a delay or there's the prescription, the patient is also not having their refills done, or there's also interactions with other medications from other providers. So the initial meeting will be set up in the primary care clinic. Definitely, we will like to make sure all the stakeholders attend, including family members and caregivers. A theoretical and conceptual framework will be the next applicable aspect that will be implemented in my project. We all know about 40 to 60% of people with hypertension do not follow their prescriptive treatment due to many causes, such due to high cost of medication, just lack of self-motivation or other reasons. And that's why hypertension has been termed the silent killer, because a lot of these patients are asymptomatic, and by the time they realize that their blood pressure is out of control, it might be too late. So one of the theoretical and conceptual models that addresses my framework of my clinical scholarship project is the knowledge spenders health promotion model. It is based on behavior modification to achieve the desired outcome. Therefore, medication adherence will be emphasized on as a health promotion factor. This model is so important because the intervention regarding the impact of education can affect the adherence not only to the pharmacological aspect of, on these patients, but also the non-pharmacological aspect like lifestyle changes and exercises, things like that. So it's very important that this aspect of model is set into this project, because affecting motivational changes that these patients can experience can go a long way even after the project for them to continue to make this So this theory notes that each person has a unique personal characteristics of experiences that affect their subsequent action. Their behavior is very important in terms of as a motivational factor, as a motivational significance in the outcome of their healthcare. So health promoting behavior is the desired outcome in the knowledge Pender's health promotion model. So this is the subsequent outcome here will be to ability for them to enhance their standard of living, functional ability, and of course, improve their quality of life in all stages, even after they're out of the project. The last phase of my presentation is the delivery and implementation of this project, which will be based in a clinic located in southern part of Silver Spring, Maryland. The population to participate again is African Americans between the age of 25 and 50 years old with uncontrolled high blood pressure. Before implementing this project, there will be some exclusion criteria. Those that are pregnant will be excluded. Also, patients who are going through other research studies with other institutions will be also excluded. This project will be implemented based on the health system model principle in line with my clinical scholarship project. The input will be the non-adherence of medications by African Americans with hypertension in the project. The throughput will focus on the educational aspect in guiding them or guiding these patients through lifestyle modification, effective utilization of my therapy app, and also reminders and the need to adhere to their medications regimen. All the stakeholders, of course, will have to concur with this plan. The expected outcome will be that there'll be medication compliance and, of course, adequate control of blood pressure. Feedbacks are always encouraged by the stakeholders with the ultimate goal to reduce the cardiovascular complication, hospitalization rate, and even death. My hope is these innovations will have a positive outcome on these patients by encouraging them to take control of their health care by simply taking their medications, monitor their blood pressure at home, and make some modest lifestyle changes. Thank you.